Good morning, all. Welcome to the session, online session regarding the dental caries. Today's topic of discussion will be about dental caries. A simplest term is, layman term is tooth decay. And this is the commonest dental pathological condition. Simple dental caries or simple tooth decay. Most commonest condition, patient arrives to the dentist. Otherwise, that is the most commonest thing. Now, it can be tooth decay or dental caries is a bacterial condition. Okay, it's a bacterial lesion seen in the tooth. And when you see the tooth structure now, the thing, it can be either the crown part of the tooth. Tooth has two parts, the crown and the root. Eventually, caries lesion or a tooth decay can be seen either in the crown or in the proximal surface or the adjoining structure, that is the root. And according to the morphology of the teeth, either it can be a pit and fish caries or it can be seen in a smooth surface. Okay. When you see this picture, when you look close into the intraorally, when you see the tooth structure present, you can see the blackish thing over here, the discolored tooth part. This is the tooth that is affected with the caries. Okay. And this is called pit and fish caries. As said earlier, it can be either in a pit and fish caries or a smooth surface caries. This is where most commonly, mainly observed on the occlusal surface of the posterior teeth, the big buccal and the lingual surface of the molars. Okay. This part, your pit and fissures, contributes to the high susceptibility to caries because your bacteria and the food debris are packed easily. It will get stuck in the pit and fissure. It stays there. It damages the tooth structure more easily. And it doesn't clear itself, self-cleansing mechanism, the saliva. Either when brushing also, it is difficult to remove the caries lesion or the bacteria or the food debris because stains get locked inside the pit and fissures. Then the other type is your smooth surface caries. You see in this picture, this is the caries that is seen in the occlusal surface of the lower molar tooth. Most commonly affected tooth is lower molar, and in the lower molar, the occlusal surface is more prone for caries lesion because of the structural change in the tooth structure. Food debris and bacteria stays easily in the thing. The next is your root caries. Okay. See the next slide. When you see in the slide, okay, you see the upper anterior tooth, that is the central of the lateral, is totally worn out. This is called as early childhood caries, most commonly seen in the younger group. That too, your milk tooth is affected. Eventually, when you see a patient in a pediatric ward, an OPD, with a worn out tooth in the anterior region, and that should be termed as your early childhood caries, or commonly called as nursing bottle caries or rampant caries. The maxillary anteriors are the affected first. If it is left unchecked, it will progress to the adjacent tooth. Okay. The next interesting part is you should think about the etiology behind this. How come this anterior alone is getting affected? That is with the feeding bottle, nursing bottle or feeding bottle, whatever it is kept. The time of placement, the feeding thing, was kept in the infant's mouth for a longer period of time, where the milk, the sugar ingredient, gets coated over the tooth which come across with the nursing bottle, and that is the result. You have the burnout anteriors. Next is your smooth surface caries. The clinical early sign of the caries lesion is you see a white chalky area seen most commonly in the buccal surface of the anterior teeth. See, if you see in the image, you can see the lesion that is there in the buccal surface of your canine, the lower canine. This is called as a smooth surface caries. Now, according to the tooth tissue that is involved, it can be termed as an enamel caries. If it is progressing to the next level, it can be a dentinal caries, or it can be a cementum, caries in the cementum. It's called as a cementular caries. Then we discussed about the early childhood caries, ECC, or the rampant caries that is seen in the infants with nursing bottle, otherwise called as nursing bottle syndrome or bottle syndrome. The other thing is the adolescent rampant caries. This is the acute type of caries usually seen in the adolescent, the age of 11 to 18, usually occurs in the tooth surface that are relatively immune to caries. Okay, can you see in this picture the permanent anteriors? See, the permanent anteriors getting affected. It is called as adolescent rampant caries. All caries lesion clinically examined with the help of a explorer, instrument that is called as an explorer, that need to check these tooth structure. Okay, if the caries lesion is a shallow cavity, that means that lesion is more superficial. It is seen only in the outermost layer, that is called as the enamel. Enamel caries. Moderate cavity, destruction of the enamel up to dento-enamel junction. And if it is a deep caries lesion, it is understood that the inner pulpal tissue is getting affected. Now see this picture very carefully. This is the superficial caries, otherwise called as enamel caries. And when it involves the adjacent layer, that is the dentin. It is called as a dental caries. And if it is progressing little deeper inside, the next layer is your pulpal tissue. Okay, that is the deep caries. And there's a classification of how the caries is classified. Famous classification is your G.V. Black's classification of dental caries. It is classified as class 1 when you see caries on the occlusal surface of the molars or the palatal surface of the anterior teeth or close to 2/3 of your lingual and buccal surface of the molar. It is called as class 1. Class 2, in the proximal surface in the molars and the premolars. Class 3, lesions that is occurring in the proximal surface of the anterior teeth but not involving the incisal angle. That is class 3. Class 4, class 6, if it is in the incisal edge, cuspal tip, it is called as class 6. So, see, as discussed earlier, you examine with a mouth mirror explorer. Clinically, you looking for any lesions there in the tooth structure. And suppose any doubt is there, not able to come to a clear conclusion, not to come to a proper diagnosis, then eventually you have to take help of a radiograph. Either it can be a bite wing radiograph or a digital bite wing or tuned aperture computer tomography. The sequelae of this dental caries. So prime importance for a clinician. Why you should bother? A simple caries lesion can turn out to be a dentoalveolar abscess, can turn out to be a cellulitis, or it can end up with a Ludwig's angina. That is a life-threatening situation. A simple caries lesion, the sequelae of dental caries. If you categorize in that part, initially it can start with your enamel, progress to the dentin, ends up in the pulpal tissue. Patient comes with severe pain, pulpitis. It can be acute pulpitis or chronic pulpitis. And if it crosses the barrier, next part is the underlying bony part. It can end up with a dentoalveolar abscess. As pus in the maxillomandible, dentoalveolar abscess. And if it is, it can progress to the next level. It told can progress to a space infection. End up with Ludwig's angina. Basic things you should evaluate when you see a patient with a dental case. So, students, now any caries lesion for that matter, any caries lesion, either it can be a smooth surface caries or in the pit and fissure caries, or it is there in the root, should be properly evaluated. The clinical examination, you should clearly know to differentiate between a caries lesion or a simple discolored tooth, a stained tooth. See, when you see the first picture, this part. Now, you see a caries lesion in the molar tooth. That is in the occlusal portion of your molar tooth. Can you see this? And the first shot, what you see is, you see a color change in the occlusal surface. Color change in the occlusal surface is a discolored tooth. That is the first sign what you see. Now that can be confirmed with the help of explorer. You should roll the explorer over there. Just slide the explorer. If you get a catch there, if you get a catch in the tip of the explorer, and that is the first clue, clinical clue, can be confirmed it is a dental caries. Simple dental caries. Then that part you should know to differentiate whether it is a dental caries tooth or a stained tooth. Okay, that can be differentiated only by using an explorer. You run the explorer in the affected part. If you get a catch over there, you can confirm it as a tooth decay or a caries lesion. If there is no catch, you can term it as simple stained tooth that can be cleaned very readily. The other part, the other thing about this pathological condition is now more emphasis has been made in the area of preventive dentistry. As the word preventive dentistry says, the earlier you find the lesion, the prognosis is better. The cost factor, replacing a tooth, the removing of the tooth, and coming at the end stage with an abscess or a cellulitis or space infection, that will cost you more. And the preventive dentistry, that part has to be emphasized more, and the clinician should not miss any when you examine the oral cavity, look through for any caries lesion. The second part, what you're supposed to see is not able to identify with a simple explorer and a mouth mirror. You can take an help of a radiograph, make a bite me X-ray, or a simple IOP, intraoral periapical X-ray. Those things will help you to ascertain whether it is a caries lesion or not. The second thing, most common thing that you should look for is you should clearly categorize the condition. That means first part is you create an awareness, educate the patient, motivate the patient, and guide the patient to a proper treatment. And that makes you a good clinician. That means you have not missed anything, doing good to the patients. Eventually, you'll be a great practitioner. And before concluding the session, you want to brush up the basic things you should know about this, the early childhood caries, ECC. Remember, early childhood caries and rampant caries, your adolescent caries, then caries that is not seen the crown part, that is in the root caries. Those things should take care of.